When it comes to the important discussions around heart health, children are often left out. But this month, the American Heart Association is bringing awareness to children's heart health with one of their special programs. Joining me to tell us more are Christina Todorich, Senior Development Director at the American Heart Association, and Dr. Derek Wyrock, Regional Medical Director for Preventative Cardiology at Cincinnati Children's in Western Kentucky. So it is Heart Month. We've had the American Heart Association come on all throughout the month because it is important, of course, for February, but really it's important all year round. And so thank you so much for coming on today to really speak about this, because children are often left out of this. We kind of hear about older people, of course, but children are really should be at the forefront too. So just really how important is this?
Well, I really appreciate that introduction and the chance to work with you and the American Heart Association, because my life is working with children and their heart health. So I'm a pediatric cardiologist or a children's heart doctor, and oftentimes when someone meets me and they ask, oh, you're a heart doctor for children, do they have heart problems? It's really surprising. About 1 in 100 children is born with a structural heart problem.
Wow.
Their heart wasn't formed in the normal way. And even among those, maybe 25% will need surgery in the first year of life.
How scary as a parent, right?
It's a scary statistic, and we partner with and work through these new diagnoses with parents. But beyond that, even a seemingly normal, healthy heart can still have problems during childhood. And we'll find that even 23,000 children each year can have a cardiac arrest, which is devastating. And how many is that? That could be around 1 in 3,000 children.
Wow, and as not only a teacher, but as a parent, but also teachers, you know, in the classroom. I know growing up, we had jump rope for heart, and of course we did that during the month of February, kind of during the springtime, but that was really it. That's all we really talked about, you know, it was just that one time of the year. But, you know, this is something that should be talked about a little bit more often, and you kind of revamped the challenge. So tell me a little bit about the Kids Heart Challenge.
Yeah, for sure. So Kids Heart Challenge is kind of broadened it from just being a physical activity event. And so we're really focused on children making the proper healthy decisions. And so there's different characters every year. This year our characters happen to be ducks, but the characters remind the kids to drink enough water, eat their fruits and veggies, get enough exercise, get their sleep. And so through those characters, they learn those heart healthy habits that will then hopefully carry through to adulthood and prevent them from maybe having you know, high blood pressure or other cardio issues when they become an adult. Also through our program, kids can learn with their families hands-only CPR and the warning signs of a stroke. And so we're really using the program as a vehicle to educate the community on those life-saving skills.
I think you do raise a good point, because there is a difference between adult CPR and child CPR. But so what are those key differences?
There is. The most important part of CPR, when I've been able to join Christina in our local schools for the Kids Healthy Heart initiatives that we're doing, we're teaching children what does CPR mean. And although it could be cardiopulmonary resuscitation, it's really compressions. Just compressions, please react, please respond, please rescue this person. And so although it is different, you still want to compress the chest. For both adults and kids alike, want to push about 1/3 the diameter of the chest, and you want to push at about 100 to 120 beats per minute with that classic staying alive tune.
Yeah.
Trying to adjust how hard you're pushing based off the size of the child or adolescent.
So does that mean typical adults, it's 2 hands, but for a smaller child, it's probably just 1 hand?
Exactly. And sometimes people wonder, if you wonder, am I pushing hard enough? You definitely aren't. You really need to be giving life-saving heartbeats to this person, pushing hard enough that you're really compressing the chest. That's typically about 2 inches for an adult or an adult-sized child, all the way down to about 1/3 the depth of the chest for smaller children.
Yeah, I think I like the way that you kind of framed CPR compressions, please rescue. I think that kind of clicks a little bit better for kids. I mean, trying to remember, you know, cardiac pulmonary resuscitation, I feel like that's so hard for kids, but kind of breaking it down, because these are life-saving skills.
We spend enough time in the cardiac ICU becoming pediatric cardiologists that you see so many cases come through. And in one case, a teenage athlete collapsed at a sporting event and no one reacted for 10 minutes.
10 minutes.
They called
Wow.
EMS, yes. And so that's where these great initiatives by the American Heart Association can really save lives by teaching people how to be comfortable, how to know what to do, and to take action.
Absolutely. Thank you so much for coming on. This is such great information, not only for parents, but for kids. Getting that information in the schools is the first step. So thank you both so much for coming on today.
Thank you. Appreciate it.
Thank
So to learn more, just go to heart.org/Louisville.